Peyronie's disease is a chronic, benign disorder of the penis that affects sexual health, emotional well-being, and quality of life. It is characterized by the development of fibrous scar tissue, plaque, within the tunica albuginea of the penis, resulting in abnormal curvature, pain during erection, penile shortening, and in some cases erectile dysfunction. Despite being relatively common, Peyronie's disease remains poorly understood by the general public and is frequently underdiagnosed due to embarrassment and social stigma. This document provides an in-depth, evidence-based explanation of Peyronie's disease, with special emphasis on sexual performance, partner relationships, fertility concerns, psychological impact, and modern treatment options. Anatomy and physiology of the penis. To understand Peyronie's disease, it is important to understand penile anatomy. The penis contains two cylindrical erectile chambers called the corpora cavernosa, surrounded by a strong fibrous layer known as the tunica albuginea. During sexual arousal, blood fills the corpora cavernosa, causing the penis to become rigid and straight. In Peyronie's disease, plaque forms within the tunica albuginea. Unlike normal tissue, this scar tissue lacks elasticity. When the penis becomes erect, the healthy tissue expands normally while the scarred area does not. What is Peyronie's disease? Peyronie's disease is defined as an acquired connective tissue disorder of the penis. The plaque may be soft in early stages or hard and calcified in later stages. Curvature can occur upward, downward, sideways, or as an hourglass deformity. Some men also experience narrowing or indentations along the shaft. The disease is named after François Gigot de la Peyronie, a French surgeon who first described it in the 18th century. Causes and pathophysiology. The most widely accepted cause of Peyronie's disease is repeated microtrauma to the erect penis, often during sexual intercourse. In most men, such injuries heal normally. However, in susceptible individuals, abnormal wound healing leads to excessive collagen deposition and plaque formation. Genetic predisposition, autoimmune mechanisms, and oxidative stress are believed to contribute. Elevated levels of transforming growth factor beta, TGF-beta, promote fibrosis and inhibit normal tissue remodeling. Several risk factors increase susceptibility to Peyronie's disease. Increasing age, most common between 40 to 70 years. Diabetes mellitus, hypertension, and cardiovascular disease. Smoking and alcohol use. Erectile dysfunction. A family history of Peyronie's or Dupuytren's contracture. Connective tissue disorders. Epidemiology studies suggest that Peyronie's disease affects approximately 3 to 10% of men worldwide, though the true prevalence may be higher due to underreporting. Many men delay seeking medical attention for years. Stages of Peyronie's disease. Acute, inflammatory phase. Lasts 6 to 18 months, characterized by penile pain, progressive curvature, and soft plaque. Early treatment is most effective during this phase. Chronic, stable phase. Pain subsides, plaque stabilizes or calcifies, and curvature becomes fixed. Erectile dysfunction is more common during this stage. Clinical signs and symptoms: penile curvature during erection, pain with or without erection, palpable plaque or lump, penile shortening, erectile dysfunction. Psychological distress. Impact on sexual health. Sexual health is often significantly affected. Curvature may prevent penetration, cause discomfort to the partner, or lead to performance anxiety. Pain can reduce libido, and fear of worsening the condition may result in sexual avoidance. Erectile dysfunction occurs in approximately 30 to 50% of patients due to vascular compromise and psychological stress. Effect on sexual performance and confidence. Peyronie's disease does not reduce testosterone levels or sexual desire. However, men may experience decreased sexual confidence, fear of partner dissatisfaction, and body image concerns. These factors alone can impair erections even when blood flow is adequate. Partner and relationship impact. Partners may feel confused, worried about causing pain, or emotionally distant. Open communication and shared medical consultations often strengthen relationships and improve treatment outcomes. Fertility and reproductive health. Partners' disease does not directly cause infertility. Spermatogenesis, hormonal balance, and ejaculation remain intact. In severe cases where intercourse is difficult or impossible, fertility may be indirectly affected. Assisted reproductive technologies provide effective alternatives. Diagnosis involves medical history, physical examination, and imaging such as penile ultrasound to assess plaque, blood flow, and calcification. Erectile function may be evaluated using standardized questionnaires. Treatment options: conservative management. Observation is appropriate for mild, non-progressive cases. Medical therapy. Oral medications have limited benefit. Intralesional injections, particularly collagenase Clostridium histolyticum, are FDA approved and effective in reducing curvature. Mechanical therapy. Penile traction and vacuum devices improve curvature and length when used consistently. Shockwave therapy, primarily used for pain relief and improved blood flow. Surgical treatment, reserved for severe, stable disease. Options include placation, plaque incision with grafting, and penile implants for men with severe erectile dysfunction. Psychological and mental health considerations: depression, anxiety, and reduced self-esteem are common. Psychological counseling and sex therapy are strongly recommended alongside medical treatment. Myths and misconceptions: Peyronie's disease is not caused by masturbation, is not contagious, and does not signify loss of masculinity. Early treatment improves outcomes. Prognosis and quality of life with timely intervention. Most men experience improved sexual function and quality of life. Partner support, medical care, and education are critical. When TO seek medical care, men should seek evaluation for penile curvature, pain, lumps, or sexual dysfunction without delay. Conclusion: Peyronie's disease is a manageable condition with effective treatments available. Awareness, early diagnosis, and holistic care restore sexual health, confidence, and relationships. References: American Urological Association, AUA, European Association of Urology, AU, Mayo Clinic, Cleveland Clinic Journal of Sexual Medicine. If you found this video helpful, don't forget to like, subscribe, and hit the bell icon so you never miss an update. We've got plenty more real talk on men's health coming your way. Thanks for watching, and we'll see you in the next video.